have we become too comfortable prescribing antibiotics?
Yeah, antibiotics added about 23 years to people's lives. So that's the estimation.
Welcome to Next Phase Human, where medicine meets performance and science meets longevity. I'm your host, Dr. Rasha, and with me today is Dr. Rasha Kuran, Infectious Disease Specialist at Kern Medical Center and at UCLA, and Director of Infectious Disease Fellowship Program. We have lots to talk about antibiotics, the overuse, the effect on gut microbiome on that, about COVID-19 a little bit, how your nutrition will affect your infection risk, and how your hormones affect your infection risk. So lots of fun stuff to talk about. Let's dive in. Thank you, Dr. Kuran, for joining.
Thank you for having me, Dr. Sandhu.
So, first of all, a lot of our viewers may not know what an infectious disease specialist does day to day. So what drove you to become an infectious disease specialist, and what does your day look like on a day-to-day basis?
Yeah, infectious diseases, the title of the specialty is a bit of a misnomer, and it implies that I treat infections that spread from one person to the other, but the majority of the infections I treat are not transmittable from one to the other, and that's why they're not all communicable diseases. Some happen when microbes move from one where they belong to where they don't belong from within the body. So what got me into this was really an excellent role model and a career role model and a mentor. His name is Royce Johnson. He happened to be my chair of Department of Medicine when I was a resident, and I fell in love with the specialty. Since then, he sponsored me and recommended me to the fellowship programs that I wanted, and so I did my residency at UCLA, and I never looked back since then, and I fell in love with it.
Well, we are all lucky to have you. As I always say, you're one of the smartest people I've known.
Oh, thank you. I'll pay you later.
So, why should healthy people who are living normally a good, clean, healthy life should care about infectious disease?
So infectious diseases do not necessarily only affect people who do not eat healthy or live a healthy life or have good hygiene. They can, some infections affect people based on genetics, believe it or not, like valley fever, for example. The likelihood of it spreading in someone's body and causing a severe infection versus not is not all predicated on the immunity itself. It has a lot to do with genetics. So really, there is nobody who is completely immune from infections.
So we'll dive into it more, but just a quick follow-up on that. You mentioned that the valley fever spreading into your body can be affected by genetics. Now, is it likely that if your parents or your brother or sister had bad valley fever, you're more likely to have bad valley fever? Is that what that means?
That's a very good question. So we are actively doing research to discover the mutations or genetic susceptibilities right now at Kern Medical in collaboration with our colleagues at UCLA. So it's not that much of a straightforward relationship, but that can happen, and where it can cluster in certain families. But for the most part, you'll see someone who has a severe disease and their family members are not, and it's not fully elucidated yet.
But there may be a component of what your genetics are like.
Yes, genetics and ancestry as well.
Got it. So, modern life. Infectious disease used to be a big part of how people died back 100 years ago. Has modern life made us healthier or more susceptible?
So it depends on what you mean by healthier. If you look at the lifespan, comparing what it is now compared with the turn of the 20th century, it almost doubled. So it went from 50 to close to 80, I think, something like that. So our life span increased. Now, the quality of life, one can argue, are we healthier or not? Looking back at the mortality rates in the beginning of like the 1900s, it appears that if most of the deaths were during childhood, so really whoever survived that early childhood period would live a healthy, long life into their 60s and 70s. So they obviously had a healthy life, and with modern times comes risk factors for infections, such as the diseases of the time, like diabetes, which predisposes people for infections. And so, it's not a straightforward, question to answer. But I would say, generally speaking, I think we are healthy. Now, if you think about the lifespan and how much longer people live, a lot of the times they didn't live long enough in the past to experience the diseases that we're having when we age.
The lifestyle diseases.
Yes, the lifestyle diseases. So I think it's complicated, but certainly with modern lifestyles comes more susceptibility to disease. We have to pay attention to them and counteract that.
And I mean, a big part of that is, of course, antibiotics. That journey has been pretty impressive, to say the least. But we're at a point in medicine where have we become too comfortable prescribing antibiotics?
Yeah, antibiotics added about 23 years to people's lives. So that's the estimation. So they are important and they saved a lot of lives, millions and hundreds of millions of lives. But we do have a problem nowadays with overprescribing of antibiotics, and it's even worse in other countries other than the United States. We have some control here, but even with this control, there's a lot of pressure on providers to prescribe and issues within the medical system where antibiotics do tend to be prescribed more than they should be.
Does every cold need a Z-Pak?
That's one of the pet peeves now, huh?
Right.
No, obviously, most of upper respiratory tract infections are caused by viruses, and antibiotics will not cure viruses. So that's one of the biggest issues.
So most of people with upper respiratory tract symptoms, presuming they are otherwise healthy, would not benefit from antibiotics.
Correct.
That's a fair statement.
Correct.
And in general, for viral illnesses, they don't really do anything, correct? The antibiotics.
The antibiotics will not affect a viral infection. Antibacterial antibiotics will not affect a viral infection. Antivirals might, but not all viruses have treatment.
And we talked a little bit about the overuse of antibiotics. What are some of the issues we are facing with that?
So it starts with the expectations from people when they get sick nowadays. I mean, for the longest time too, they would go to the doctor or the practitioner or the provider expecting something to be done. And I think there's pressure on the providers to prescribe something, even though studies have shown that education and reassurance can be satisfactory to the patient. But a lot of people do feel that pressure. And I think it's not as bad as it used to be in the community. And with the advent of the rapid testing that we have nowadays, where you can check someone for influenza, group B, the streptococcal infection, on the spot, that helped withhold antibiotic prescriptions, especially in children. So that's one of the issues. But there are many others, and some of them have to do with the specific situations, like here with valley fever. Valley fever, it manifests like the flu initially, fever, chills, and then cough, and then pneumonia. So it is a type of pneumonia. And 1/3 of community-acquired pneumonia in an area like ours is valley fever. But it's very rare that this gets diagnosed the first time. The person goes to the ED, so because it's confusing and it looks exactly like bacterial pneumonia. So patients with valley fever, on average, get 2 to 3 courses of antibiotics before they actually get diagnosed and then take the antifungal medications that treat valley fever. So that's another way where if we diagnose valley fever early, we would save all these antibiotic prescriptions and treat the patient sooner.
And that's more common for the area that we live in, where valley fever is endemic.
Yes.
in the Central Valley of California. But my understanding is with the changing climate patterns, we are seeing it beyond Central Valley areas too. Is that true?
Yes, it is. It's common in Arizona and the Central Valley in California and some Central and South American countries, and then the surrounding states such as Texas, New Mexico, Nevada, etc. But yes, we are seeing more cases now outside the zone due to changing weather patterns.
And just kind of pivoting back to when you mentioned for the common cold check, the test for strep and whatnot. So if, as a parent, someone brings their kid, and most common scenario is either to primary care or their urgent care, local urgent care, with cough, cold symptoms, what are some of the things they would ask or reasonably expect to be done before, from an infectious disease standpoint, okay, do this, this, and this test, and this is what parents should be asking?
So a thorough history and physical examination, that's always the base. Examine the patient, look at them, look at their vital signs. It is tough to distinguish viral from bacterial infection just by examination, though. So that makes it challenging to pinpoint whether it's a virus or not without testing, really. So I would say if testing is available for the strep throat tests or influenza testing, COVID-19 testing, if it's available, I would say yes.
So those three would be the base that you would start with?
Yes.
Fair enough. And then generally, if all that is negative,
there's
is
no
it
need
reasonable to hold off on antibiotic and see?
Yeah, there's no need for antibiotics.
Perfect. And are we approaching a future where infections get more and more difficult to treat?
Yes, they are getting more difficult to treat, in part because of antibiotic resistance. And another part is people are living longer with more immune compromising conditions like transplantation and autoimmune disease treatment and cancer treatments are advancing. So people's immune systems are not the same like before. They're not homogeneous as they used to be. And so you can get really challenging infections. They are more difficult to treat now. There's almost like subspecialties in infectious disease now, where some people specialize in solid organ transplantation or hematologic transplantation or orthopedic infections, etc., because they're getting more complicated.
And in terms of those infections that you treat, what are some of the organisms that you really, as an infectious disease specialist, worry about in the hospital or in the community? I mean, you hear it all about patients talking about MRSA, and that's the dreaded word. So what is that? What is that actually? And why should people in the community worry about it?
MRSA it's a staph infection. Staphylococcus is a bacteria that we all can carry on our skin, but there are strains that happen to be more resistant to antibiotics when they do cause an infection or get inside the body, cause pneumonia or skin infection. These new strains are more aggressive, and so they cause infections more readily. And also they are more resistant to the antibiotics, and they require special advanced antibiotics to treat them. And so the original Staph aureus or staph bacteria used to be called methicillin-sensitive Staph aureus, and then MRSA is methicillin-resistant Staph aureus. That's one of the challenges. And even the antibiotics that we have been using for that MRSA there's small, amounts of resistance that's building up
Even
in it.
the ones that you use now for that?
Yes. Yes.
And that's likely due to overuse of antibiotics?
That's likely due to the use of antibiotics and certain host factors as well. So it's the pressure of antibiotics while the bacteria is replicating that produces resistance. So someone who has an infection and we're not able to surgically clear the majority of it and giving antibiotics at the same time, that's the most difficult and most conducive to resistance occurring. It's when the infection source is not removed, but we're giving antibiotics.
So should a normal person going down the street worry about MRSA?
Yeah, you can get MRSA from the gym.
Okay.
From any skin-on-skin contact with other people, or short period of time between someone else touching the same item. So if in the gym, people sit on the same seats and it touches their skin, you really want to disinfect the seat before using it. Doorknobs, or taking care of people or touching someone. So it doesn't live in the environment for too long. Usually 4 hours is the time we say, but you can get MRSA from the community.
And that could cause a skin infection or worse?
Or worse, can go to the lung, the brain, the blood. It can go anywhere in the body.
So what can someone do? Sterilize the surface in the community places like gym that you use?
Yes, surfaces where other people touch.
Mm-hmm.
I generally, doorknobs, I think I would hold the doorknob with a tissue paper, or wash my hands, or use a sanitizer after touching doorknobs, or touching surfaces like this, or the gym, especially the gym, because the sweaty, moist environment is conducive also for the bacteria to
So
grow.
it's primarily pertaining to the gym.
Gyms
or similar locker room kind of environment.
Yes.
Okay. Now, there is a topic which gets a lot of talk, but at the same time does not get enough. That is the antibiotic use in livestock that we eat.
Mm-hmm.
And like antibiotic use in cattle or chicken. And how does that affect us? What are some of the downsides that we see from that?
It does affect us. And I'm empathetic to farmers who are raising animals or cattle, and if they get sick, what do you do? Of course, they need antibiotics to treat the animals. I'm not an expert on animal health, but the use of the same categories of antibiotics that we use in humans, using those in livestock has led to significant resistance in antibiotics we call quinolones, for example, and something called C. diff. That's a bacteria that causes like a potentially deadly diarrhea in humans if exposed to antibiotics. You can now get C. diff even if you've never been to a hospital. So because animals get it. And that has to do with antibiotic prescribing. So it's a complicated problem, and I can't just simply say, oh, nobody should use antibiotics for animals, but it should really be regulated and studied more.
And in terms of like if someone does not eat that meat, like does even drinking the milk or coming in close proximity with those animals, is that enough?
So if you're drinking the milk and the animal just took an antibiotic and it's still in their system, that's one way you'll get the antibiotics with the milk. But also the colonization of these resistant bacteria on the meat when you buy it. So when you buy meat from the supermarket, there's usually bacteria on it, and that's killed when you cook it. So they can be colonized with that resistant bacteria and the C. diff bacteria.
But when you cook it, that should...
Yes, but cross-contamination is so easy to happen in the kitchen.
So from like meat to the vegetables you have in the kitchen or something, the bacteria can come in close contact. And
yes, this is the reason they say don't wash your chicken, is because you turn the faucet on and water splashes everywhere, and then it takes the germs to the utensils on the side of the sink that you're going to use later to cut your salad. So it's even more subtle than that. You don't have to use the same cutting board to transfer this bacteria. It could be just the splashes when you're washing chicken. That's why CDC recommends against washing chicken.
So don't wash chicken?
That's what they say.
Okay.
And I'm not going to say what I do, but yeah.
Okay. What do you do?
I wash it. I'm very careful about the stream and not splashing the water around. But it's recommended not to wash it.
Okay.
Yeah. Mm-hmm.
But you wash it, just careful.
I'm very careful.
Got it. So someone got antibiotics, whether they consumed it or they got it through the milk or whatnot from the animals. What happens to your gut with that?
So our gut is an entire community of microbes. So there's billions. I think most people know now there are billions of microbes living inside our body, inside our gut, and on our skin. And those microbes help us with our life. They manufacture vitamins for us. It's tremendous what they do to us, and I don't think we scratch the surface of what they do. We don't even understand exactly what the microbes do to help our bodies. And taking like one course or dose of antibiotics can disturb. The antibiotic doesn't distinguish good bacteria or bad bacteria, so it just kills bacteria that is susceptible to the antibiotic, and that can really disturb the balance of the microbiome, we call it. And so it can take up to a year for the microbiome to be restored completely after taking
one course of
antibiotics. Wow. Yeah. And like babies born by C-section, their microbiome is different than babies who are born naturally, because babies get also some microbiome from their mom as they pass with natural delivery, and so this is a science that's now starting to develop, and we're starting to understand how immense the effect of the microbiome on our body. It literally talks to our brain through the vagus nerve and sends signals to our brain, affects mood and depression and weight. And I think we cannot live without our microbiome.
Yeah, no, I was reading certain bacteria are related to weight gain. Like obese people have more of that.
What happened is there was an obese person who donated fecal microbiota.
Fecal transplant is a thing.
Which is so that C. diff infection that I mentioned earlier. The best treatment for it is to get a healthy stool from a person who's healthy and give it to that person with the problem, and that instantly stops the problem. This is how powerful our microbiome is. So they did that once where the donor was an obese person and the recipient has never been obese. And after the procedure was done, the recipient became obese.
Wow. So it's your bacteria which are telling you what to do.
Yes.
For most part.
So you wonder if we're there for them or are they here for us, really.
Very interesting. Yeah, just for this is a medical procedure. Don't do this at home.
Don't do this at home, no.
So we live life, and if there's an infection, you have to take antibiotics sometimes. And now that you told me, it takes a year for microbiome to recover. And sometimes there's more than one course of antibiotics for a bad infection. Now, what can I do to help my body?
Yes, there's a lot we can do. So this is actually one of the interests that I have in my career. I became fascinated with this early on when I started practicing, where my office was like half of my patients were post-menopausal ladies with urinary tract infections. And it was puzzling to me. Those ladies would have no infections until approximately 10 years after menopause, and then they start getting one after the other, and they can die and can get admitted to the hospital. So what is it about their bodies that changed? So I started reading into this, and it wasn't that well known at the time, and discovered that the skin in the urinary tract, the health of that skin is dependent on estrogen. And so once we lose the estrogen, that skin becomes dry and weak, and the immune cells go away. And so bacteria can get in and cause infection. And so those ladies lived like miserable lives. They would be depressed and feeling shamed, and all they got from their providers was prescriptions of antibiotics and lectures on hygiene, and it was really tough. And so there were some studies showing that if you replace the hormone topically, that can stop the problem. And I started prescribing it. And those ladies were just calling me to say, Dr. Kuran, 6 years, no UTI, or 5 years or 3 years. And that really was tremendous. So this got me thinking, so infections are caused or happen when there's an imbalance between our immune system and the microbes. And so what else is there that we can modify by non-pharmaceutical interventions, or just being healthy, or replacing something where we can prevent or treat infections? And I have special interest in that topic.
So what more can we do? I mean, this is so impressive, just hormone replacement, recurrent UTI is gone. For an average person gets antibiotics, what do you tell that person? Okay, do this, this, and this to help your gut or your body.
For the gut, you want to rebuild your gut microbiome and keep it healthy. So it's what you feed, which germs do you feed is which microbiome you get, what type of microbiome you get. So there are foods that feed the beneficial bacteria, such as soluble fibers, for example. So it all goes back to processing of the food. There's been studies where the more processed food is, the less soluble fiber and the less nutrients there is in it. And as a matter of fact, the more disease people get when they eat it. So really it goes back to eating natural food. And there's another study that showed that people who cook food from scratch at home, even if it's the same meals, the same types of meals, are healthier than people who buy their food cooked or eat out. And so keeping ourselves healthy and eating the right food, that's what prebiotics are. And so it's the food that feeds the good germs. And then those bacteria are the probiotic, what we call probiotic. So eating the right thing and not eating the bad stuff, such as processed food, pure sugars, especially the high fructose containing beverages. Those are straightforward, the highest bang for the buck. If you want to stop something, it's the high fructose.
The liquid sugar.
Liquid sugar, yes. It mugs up the immune system and causes fatty liver and just really affect our health negatively.
Do fermented foods help?
They're good, yes. And you could see that our ancestors ate them regularly.
Right.
So there has to be a evolutionary selection to it. So fermented food is good, and the more naturally fermented it is. So like if you buy the olives in a can, I don't think there's much live microbes in that. But if it's truly pickled olives, for example, those are healthy.
And how many servings of fermented food should a normal person
have? I really don't know. I've never looked into this. I know that it's healthy to eat them.
Right.
Probably
there was a Stanford small study which recommended 3 to 5 servings a day in general for health. And that would include all fermented foods like sauerkraut, kimchi, kombucha, whatnot.
I believe it.
What's your favorite?
My husband would be happy. He eats olives with everything. But there's more to fermented food than olives, obviously. No, I personally, we would eat, I like to eat fermented food with every meal, but it's not everybody's taste.
It's a good addition if someone can.
Yes. Like in the sandwich, I put pickle, olives with breakfast. Our Middle Eastern food has more pickled food naturally. So it's an essential part of any meal to have pickled or fermented food.
And do you routinely recommend prebiotics or probiotics for people who are on antibiotics?
Who are on antibiotics? Yes, I do. Now, the problem with probiotics is not all of them show benefit. So there's been many studies, and there are many products out there on the market. And not all of them have been shown to prevent the medical problems that occur, at least very deadly problems such as C. diff. So there's one product that I would prescribe and recommend to take while people are taking antibiotics. Now, that doesn't mean that other products don't benefit, but I, as a physician, prescribe the ones that have shown benefit in randomized large clinical trials.
And what is that product for?
It's called BioK Plus. So this is not an endorsement of the product, but BioK Plus is the one I prescribe when I prescribe antibiotics.
And for someone who is not on antibiotics, has not been on it for 6 months, and I see a lot of people, they do take probiotics. Is there any role of that in health? So
for health maintenance, I think there are some studies here and there for allergies or for inflammatory bowel disease. I don't tend to study those as much as infectious diseases. So I would imagine that there are some, but I haven't looked into them.
But there would be, stands to reason there would be different probiotics which can suit different people. So not every probiotic may not be a viable one for every person, so to speak.
And not every probiotic that you take by mouth is guaranteed to get to the stomach, because the stomach has acid and that's designed to kill germs. And so does it really get to where it would work? And then when it works, what is it going to do? The only way you would find out is if you do an actual study and look at the outcomes in large numbers and look at the statistical significance.
So you mentioned briefly on this, the gut issues with it can have effect on other diseases. So when we use antibiotics, it affects the gut microbiome. It'll affect the lining that the gut is coated with. And there's some suggestion that it may increase allergies or autoimmune disease or whatnot. Is there truth to it?
Yeah, there's been studies that showed an association. I don't think it was exactly defined as a causation, but there's an association with children who take more antibiotics having more diseases such as asthma and allergy and obesity.
So just pivoting a little bit, there's a lot of parents that watch, and are kids receiving too many antibiotics today? I think so. And you have people who don't give their kids antibiotics, but then I see people who, out of love to their kids, the people do this not as a with bad intention, obviously, but because they're worried about their kids and they want to help them immediately, they'll take them to the doctor, and then that issue of pressure and prescribing practices can contribute to more prescribing there. And this early life exposure, obviously, they have much more of life's runway ahead of them than adults. So this early life exposure, what problems can this cause for the kids, like a lot of antibiotic exposure early in life?
Yeah, that's been linked to more asthma, allergies, and obesity in some studies.
And autoimmune disease. And in terms of when should parents feel comfortable saying, you know what, can we safely wait if someone is wanting to prescribe antibiotics? When is it reasonable for a parent to just say, you know what, can we wait, and what should I look for if we need to change this?
If the child doesn't have a fever, generally it's safe to wait. And then if it's been a week and they're not getting better, that's when you want to check into it. But or going to the doctor and then checking that rapid test and not finding the streptococcus bacteria. That's the main dangerous one in children is streptococcus. It's a type of bacteria that can cause problems. If it's not, the test is negative, I would wait.
So for the parents who prefer antibiotics for their kids anytime they get sick, what advice would you give them? It's not an act of love. I'm sure it's an act of love, and I would never doubt the intentions, but just educating that there's really harms, because I think the general public doesn't see that there's harm in giving someone antibiotics. So if there's an infection, if they benefit, and if they don't, it's not bad. So educating or spreading the data that we have on the effects of antibiotics, I think, would make people make a better choice and more balanced choice. So we overstate the benefits of antibiotics in our discourse and likely understate the adverse effects.
Correct.
For that, especially for kids.
Mm-hmm.
I'll switch gears a little bit, and we went through a whole COVID epidemic. And looking back as an infectious disease doctor, what is the take-home message for you now, hindsight being 2020? What would you say lesson learned?
Lesson learned is, I think it's not for me maybe, but mixing politics and medicine is not a good idea. It was a painful time on all of us, because we were truly having a hard time and working hard and going through the difficult treatments and developing protocols and moving fast. And at the same time, there was a lot of politics going on, and people trusting the medical community that changed. And so the lesson is, I don't want to be involved in politics, and I'm just a doctor, and I want to stay away from that.
We want to help people. That's
just
all
want to
we
help
want.
people, and that's based on what we know.
So if COVID first appeared today, what would we do differently than what we did?
If it was up to me, again, regardless of how did it start or where it's here. So to protect ourselves. And really, those precautions have become very politically charged. But I would protect people from getting the infection by the precautions that we use, and
hand washing, masks.
Yes, yeah, and
for
I know
vulnerable population, especially.
And there's data now, people conflicting whether the mask helps or not, does not help. It all depends on how this study is done, and what does the study look for is what the outcome shows. So there are studies that show that wearing a mask does not help, but the study was done in a way that would not help. So masks do help, and especially if the person who is sick is wearing them all the time, and that's the only way they would work. So it's before they get symptoms, and that's why it's confusing. People are infectious before their symptoms start. So at that time, during a pandemic, is wearing masks all the time around people, and that's hard, and it's not easy, and it's very difficult. But implementing that early on, and maybe utilizing that IV immunoglobulin treatment early on as well. It helped a little bit until the vaccines came out and until the medications came out. There's going to be pandemics in the future. That's not going to stop happening. And the question is, how well prepared are we for them? Because they are going to happen, whether we like it or not. Because viruses do mutate and change and hybridize, and they mutate in animal bodies and our bodies. So that's just a fact of nature. We cannot change it.
And is there, like, COVID has changed? A lot of us have immunity. So the pandemic rules, of course, regarding the masks don't apply now. It'll be difficult to assess someone who has not had an infection. But in terms of infection, is it more like flu now that we live with for years?
Yeah, it's less severe now.
It's less severe now.
Because the majority of us have had some immunity against it. So it's not as deadly or severe as it used to be.
Who remains at highest risk?
So groups that are at high risk are at high risk from influenza and COVID-19 and all viruses, including RSV. And that's people above 65 years old or very young, especially premature babies, people who are taking immunosuppressive medications. And the most commonly prescribed one is called prednisone or steroids. And those are given commonly in the community. So immunocompromised and the extremes of age.
Do you see a lot of long COVID?
I used to get those referrals, but because we are infectious disease physicians, like there's no antibiotic or something I can treat it with. So they ended up being treated at certain centers that focus on them, and they have research grants for them, like in Stanford, for example. So, but I, you hear people talk about it once in a while, and I know people whose lungs changed after having had the COVID infection. So it definitely happens.
And so there is a lot, like you hear about either the breathing never went back to normal or the brain fog that is just there.
Mm-hmm.
So for those people, there are specific centers like UC Davis or Stanford that have the programs to help them.
True. It's like a scar on the immune system. It causes a change in the way the immune system operates that is lasting, similar to valley fever, by the way.
And how have COVID vaccines evolved since, like, do we have new vaccines like flu vaccines every year? For COVID?
Not every year. And they stopped being recommended now as as part of the usual recommendation that we have for patients, and it's a choice now to give them to the patients who agree to take them
or who are at
want to
higher
take
risk.
them.
They have the option,
Yeah,
but not everyone has to have them.
yes, it's not recommended.
Flu vaccine.
hmm
Do you recommend it for?
I recommend it and I take it, and everybody I know takes it.
So, flu vaccines, do you see that changing? Like we have mRNA vaccines for COVIDs. Do you see that changing for flu vaccine also? Is that an era that we are headed into?
It's up in the pipeline, yes. It's probably going to happen. Yeah.
And I mean, there's a lot of controversy about vaccines. If you had to pick subgroups of people who would benefit most from staying up to date with vaccine, what would that population look like? Not everyone would be in that, but who would that be if you had to pick a certain subset of people?
Children. And I mean, that's how, that's the group where vaccines worked, and it saves the most lives in children.
And young, healthy adults, is there any vaccines they should kind of look into on a routine basis or not?
There are. So vaccines, it's a matter of choice. Now we have a vaccine, for example. There are vaccines that protect from cancer. And this is tremendous. So there's something called HPV. And that HPV is a virus that is sexually transmitted and causes cervical cancer, causes throat cancers, causes other cancers. And there's a vaccine now for the virus that causes the cancer. So you're preventing cancer with a vaccine. That's already happening, and we're giving it to our patients. That's recommended now in teenagers. I would definitely recommend it before they become sexually active. Hepatitis B vaccination is a vaccine that prevents cancer because hepatitis B can lead to liver cancer. So all the recommended vaccines really, they're recommended for a reason, and I would use them.
Flu vaccine, who should take it in general public?
I mean, I take it every year in part because it would make the flu less severe on myself, but also to protect people around and not spread it to the vulnerable around me. So I think everybody can and, in my opinion, should take the flu vaccine.
Is the immunity different from what you get from infection or versus what you get from vaccine?
It is different, and immunity from the infection is usually more lasting or more intense. But again, you're gambling with the actual infection possibly causing harmful outcomes. So that's the choice that you have to take.
Is there a hybrid immunity that you've had infection and then vaccine? Is there benefit to that on top of what you had?
So our immune system, the way it works is it makes antibodies against a virus, for example. And then there's other viruses. It gets busy with fighting something else and then something else. And then making antibodies takes energy. So the body cannot focus on all infections and make antibodies in the same levels for all viruses. And so it prioritizes the most recently exposed one. So when you give a booster or a vaccine dose, again, it boosts the amount of antibodies in the body against that infection.
Got it. So this is really intriguing conversation, and I think there's a lot more that we have to talk about, including the valley fever and the hormones and nutrition as pertains to your infection risk. So we'll close out here today, and we'll come back for the second part of this conversation, which should be a lot of fun.
All right.
Thank you so much.
Thank you, Dr. Sandhu. It's been fun.
Thank you.
Thanks.